Hi everybody, this is my 18-month conclusion video to my trial of using antibiotics to try and treat my MS. I'm sorry that the video is so late again. I know I say that every time. I'm really rubbish at doing them. I had the great plans at the beginning to be doing vlogs every couple of weeks or so, and it hasn't worked out that way. But that's mainly because I haven't really seen anything happen or had much to report on, unfortunately. I suppose my conclusion for this 18 months is simply that it hasn't done anything for me at all. I've continued to relapse. I've continued the slight downward slide of MS. I haven't seen any improvements at all, and I struggled a lot with the antibiotics themselves. I'm sad to be saying that because I had hoped that this would be more positive. But I think a disclaimer I'd throw in right now would be that because I had so much trouble with antibiotics, I don't know how valid what I'm saying is. I certainly think with regard to the third antibiotic, the metronidazole, I had huge problems with that. My body really couldn't take it at all. It did awful things to me. It took me long enough to be able to feel fairly stable on the first two. But when I introduced the metronidazole, I was never able to take it or pulse it at the levels that most people do. And I have wondered since whether that has had any negative effect on my outcome with this. Certainly I asked partway through the protocol, my prescribing doctor, I asked him whether I could switch over to another antibiotic, but he wasn't willing to prescribe it to me, which was a shame because I think it's one that people tolerate slightly better, certainly people like me. So it was a shame I never got to try that. I kind of wish I had, and I think if I ever in the future go on to continue and try again with the antibiotics, because I certainly haven't ruled it out, I would probably try and get hold of that one instead or use a slightly different variation on the antibiotics. So, it's not all doom and gloom. It hasn't worked for me to this point, but, I only did 18 months, and for some people it take more than 2-3 years to actually have any effect. If you go to the CPN boards, which are all listed down there in the blurb box, and talk to people, you'll see, some people it took over 4 years for them to have any results, which is a bit crazy, but it seemed to be so. So I don't know what I'm going to do. Unfortunately, I stopped just shy of the 18 months because I had an accident and I have had to have a couple of operations, and I was on a lot of painkillers and drugs and stuff, and it all just became too much for me. But yeah, I wouldn't rule out trying a slight variation on it again. I think if you are thinking about doing it, then the best thing to do is just arm yourself with knowledge, go to the boards, talk to people, read absolutely everything that you can, because there are an awful lot of supplements involved in doing this protocol, and you need to protect yourself. You are taking an awful lot of antibiotics for a long time, and you need to protect your body from any ill effects, and so you need to know exactly what you're doing. You need to talk to people and arm yourself with that knowledge. At the moment, all I'm doing is trying to be super healthy. I've got another operation to go, so I won't be taking anything for the time being. I'm just juicing an awful lot because I've got an amazing new super juicer and it's brilliant. So yeah, I'm just trying to be super healthy. I have no plans to do anything, but if I do, and if I go back onto the protocol, then I will continue the videos and I will let you know how I get on and continue doing more updates. But certainly for the time being, there's not much more I can say, except that, to this point it didn't work for me. But I have been a very difficult case with these antibiotics and the fact that I haven't gone along with them. So if you're going to give it a go, then I wish you the best of luck. There's absolutely no reason not to, if as long as you know everything you need to know about it. It's very difficult with something like MS because we do kind of have to treat ourselves to some degree. Once we've been through the rigmarole in the first few years of neurologists and the drugs like Avonex and Copaxone and Rebif, and it worked out whether we want to try Campath or Tisabri, or whether we want to try the CCSVI, which I did actually have CCSVI treatment, I have to just point out at this point, and it did nothing for me whatsoever either, which is unfortunate because I was in a room with 4 other women, all of whom had some results from it, so that was a shame. So maybe this is just my luck, I don't know. But yeah, I wish you the best of luck with whatever you do, and I'll probably see you in some videos in the future. I won't say soon, because you know how rubbish I am at doing these. But take care, look after yourselves, and have a great Christmas when it comes around. Okay, bye!